This is a video of how to complete the monthly PEWS audits for ESNEFT Pediatrics. So what we've got on this screen is we've got an example PEWS chart in the pink boxes, and then we've got a list of the audit questions down the left-hand side. So to audit, you are going to look at as many children's notes as possible and choose those children for audit. You're going to get one of their observations charts. So if this is a child that has been in for a long time, has many PEWS charts, just choose one that you are going to audit. You're then going to write their hospital number in this top section here. You're then going to check to see if it is the correct age chart for the child. So this example one is 0 to 11 months old, and I know that this child that I'm auditing is 2 months old, so I'm happy that this is compliant, and I'm going to write a yes in this box here. I'm then going to move on to my carer question, and this is very dependent on the area in which you're auditing. So if you're auditing children's inpatients, I would expect to see something written in each of these boxes here for every set of observations. So we want to know that that parent is being asked that carer question each time, unless the parent is asleep, so which they've written here, or the parent is unavailable, on which they would write you. So we want to see something written in every box for in children's inpatients. If the child is in CAU or ED, we do not expect that question of how is your child different since I last saw them to be asked when the child first presents to the emergency department or CAU. But what we do want is you to acknowledge how the parent is feeling. We want you to acknowledge that if the parent, after you've started treatment on that child, is the parent still saying to you, my child is not very well, my child is worse, I'm worried about my child, I'm really concerned, I think they need to be seen. If they are saying these things, then you can start documenting this in this question and you escalate that to the nurse in charge. So for those areas when you're auditing, so this child, this example PEWS chart is taken from the emergency department. So you can see that the first two set of observations, they haven't asked that question, and that's okay. I'm happy with that. And then they have started doing it about 3 hours in. They've then started asking the parent the question, and that's exactly what we want to see from these PEWS charts when they come into those when they first present. So for this chart, I would mark this one down as compliant for an ED chart. If this chart had been done in the inpatient area, I would mark this as non-compliant because you are missing some areas there. Okay, so moving on to the blood pressure question. So did the child have a blood pressure on first presentation to the area? Your options for the answers are yes, no, or that the RN has documented U0 in the column. So let's go and have a look at the blood pressure section. So that's here on your screen. So we're going to go to the first set of observations that are done when the child first presents to the area. So in this case, this child doesn't have a blood pressure, but they do have the code written here. They've actually documented the wrong code here, so they've written UT0, T0, it should be U0, but I understand what the RN is trying to say. So U0 means that they had an unsuccessful attempt, but they're not concerned that the child's compromised at all. So you would then go up to your audit and you would write U0 in this section here. What I would then expect to see, because they weren't able to get a blood pressure on first presentation, I would then expect them to return to the child and try again later, so which they have done. So I'm really pleased to see that. And they've gone back to the child and they've attempted again. Unfortunately, they haven't been able to get a blood pressure, but that's okay. They've tried. So that's a compliant audit. So if I go back to my next question, which is, if the blood pressure was not taken on first presentation, has an attempt been made? So I'm going to write yes on this because that is compliant. And then your questions about blood pressure stop for this example. Now, the other options that you might see when you're doing auditing is, so we go to the first question, did they have a blood pressure on first presentation? If you go to the PEWS chart and you notice that there is nothing here, so there's no blood pressure, no codes, then that means they're non-compliant, so you would write no in this box here. You could then go on to the next question and see, did they then follow this up? So they didn't do anything here. On the next set of observations, did they then go and attempt a blood pressure? So you could look there. They have 2 hours to get an attempt. So if they find, I don't know, that they're doing 15-minute observations, then you look in the next 2 hours to see if a blood pressure has been attempted or has been done. Okay. So if one hasn't been done within 2 hours, then you would write no here. If, again, within the 2 hours they have made an attempt, then you write a U0 here. Okay, so your third option that you might go to is you might go to the first presentation observations, and you might find they have done a blood pressure. So let's say this third column here is your first presentation to the area. They've done a blood pressure, they've documented it in the value, that's brilliant. So then you would mark this as yes, compliant. So if that's the case, you then do not need to go on to the next question. So that is not applicable for people that have marked yes on this row. So moving on to oxygen question. So has the method of oxygen delivery been documented, or if they're on air, have they documented air? So we're going to go to this section here, so your oxygen section, and I can see on this chart they've marked that they're on air every single time. So I'm happy that that's a compliant audit, so I'm going to put a yes in this box. If the child was on oxygen, then we go to our next question, and we have a look to see how they have documented that oxygen. So first of all, have they written the percentages in, and have they done them as dots? So they should be as dots on these lines, the percentages. If they are receiving something where they have litres per minute, so let's say nasal cannula, then the staff should use this scale here for litres per minute, and when they are documenting it in here as litres per minute, they mark it as a cross. So we can clearly see the difference between litres per minute as crosses and percentages as dots. Just to mention for the question above this, there has the method of oxygen delivery been documented. For those children on oxygen, you are then looking to see if your delivery method down here has been written. So we want to see that they're using these codes, so non-rebreathe or a face mask or a head box. Okay, so that's all of them on oxygen. Now moving on to your capillary refill time question. So for the CAT refill, what we want to see is we want to see that it's documented in seconds and not ticks. So this is really important, because if a child's CAT refill is more than 2, there's a big difference between a CAT refill of 3, for example, and 8. So it's really important that we know that rather than just having a tick in that box. So this is our CAT refill section, and you can see here the child's CAT refill doesn't go more than 2. The first one, unfortunately, is a tick, but the rest have been nicely documented as less than 2 seconds, so they've used the times. So I'm happy that that is a compliant audit. So I'm going to mark a yes in there. Okay. Next one is about the PEWS score and whether it's been calculated up. So if I look at the PEWS score here, we have got a PEWS score that's been calculated for every set of observations. So I'm happy that that is also compliant. So I'm going to go to my audit form and I'm going to say yes, a PEWS score has been calculated. I then want to see, is the PEWS score correct? So I'm going to look at the PEWS chart and I'm going to calculate. I don't want you to calculate every set of observations on every PEWS chart that the child has. Just pick 4 or 5 of them and see whether they are correct. Try and choose ones where there are different nurses on different shifts, so you're not targeting that same nurse. So you're looking at across all of the obs charts to get your 4 or 5 examples. If you find any that have been calculated incorrectly, you are going to mark that as no. So that's non-compliant. If they are all correct, that is compliant. and you're going to mark a yes in this box here. Next one, is your child's AVPU or sedation score monitored? So you're going to go down to your AVPU, and what we want to see is something written in every box along here. So you want to see that, so this child, we've got alert all the way through, a couple of sleeps there, a couple of sleeps there, but alert. So I'm happy that they've been documenting the child's AVPU throughout their stay. So I'm going to mark this as compliant. Next, I'm going to look at the charts, the signature of the child, whether the chart has been signed by the RN to say that they've done their observations. So you would look at that bottom strip. I haven't included it on here just purely for confidentiality reasons, but you're looking to see that it's signed. If there are any that are missing the nurse's signature, then you mark that as non-compliant and you put a no in this box here. Lastly, you go to your clinical intuition box, and it should be marked. The options are a yes or no, so you should be able to see whether this has been completed all the way along. And this clinical intuition box is really your chance as RNs to be able to document whether you feel that this child should be escalated, whether you're concerned with this child despite what the new PEWS score is. So it might be that they have a PEWS of 1, but you are worried, so you'd mark a yes in this. I just want to see whether this is being filled out by the RNs. You've also got a free text box down here. So if you wish to send any information, further information about any of the children of why you've audited something like it is, then you can add that in that row there. Just please make sure that you reference which child you're talking about. So you could either choose which column they're in by the numbers up here, or what their hospital number is when you reference them down here. And that is the observation audit. So any more questions, please talk to your line manager or the clinical nurse specialist for deteriorating patient. Thank you.